Your student with voice for today. So today, I'm going to demonstrate intravenous cannulation or IV insertion. This procedure serves as routes for medication administration by blood or other nutrients through the vein by inserting intravenous cannula. Before we start the procedure, make sure to introduce yourself to the client, know their name and their birthday, apply the rights of administration medication if it is the right patient with the right medication and the right route, and if it is the right time and right documentation. So here is the procedure. First thing to do is check for the physician's written order if what type and amount of IV fluid should we administer to the patient. Second, assess the patient. Ask if it is their first time having an IV therapy or they already have done before, and ask if which arm they use during their past experience of IV therapy. Then, determine for the accessible site for this intravenous insertion. After that, wash hands for infection control and prepare the equipment needed for this procedure.
So here is the equipment I prepared. I have gauze pad, alcohol swab, IV cannula with 22 gauge, and then IV set, surgical tape, tourniquet, disposable gloves, alcohol, IV fluid, then kidney piston with cotton balls with alcohol and dry cotton balls. So check for the sterility and integrity of our materials. Check the expiration date. Here, so it's 2023. Our IV cannula expiration date, 2024, and this our IV fluid.
And now, after we prepared all the equipment needed for this procedure, prepare your clients and their family by explaining to them the procedure and its purpose of insertion. So, hello Miss Ridber. Today, I'm going to administer IV fluid upon your physician's order for your medication. Is that okay for you? Thank you. After that, assess your client in a comfortable position to avoid unnecessary movement during the procedure. So, after we open our sterile package using aseptic technique, check for the IV solution regarding to the right administration of the drug, if it is the right medication for our right client, and if it is the right solution. Then, open the seal. After we open our IV fluid, clean with cotton balls with alcohol here, then dispose. Open the infusion set. Fill the chamber at least half. Then, prime the tubing to eliminate air into tubing. As you can see. Okay. select for the vein for IV placement. Then, apply tourniquet 2 to 6 inches above the selection site, above the insertion site. Then, check for the presence of radial pulse. Then, clean the vein area using an alcohol swab or if you have a cotton balls with alcohol. Clean it in a circular motion from the vein to the outside 2 inches. Dispose and let it dry for at least 60 seconds. And now, encourage your client to take a slow deep breath as you begin the IV insertion. So, Miss Bear, relax and take a slow deep breath as I begin to insert the needle. It may be a little uncomfortable, but relax. Hold skin taut. When you're inserting a needle, make sure that the bevel is up to avoid injuries into the vein. Stretch the skin. Position your needle into the 15 to 30 degrees angle. And now, push the needle 1 to 4 inches until the blood is noted. Then, slide the catheter, cannula, before pulling out the needle. Okay, scored. Then, put a sterile pad under the hub while applying pressure into the catheter. Remove the tourniquet. Then, connect the infusion tubing. Then, put a tape in the catheter to avoid moving. One in the tubing. Then, open the roller clamp to allow fluid to flow freely to a few seconds. Regulate IV flow manually or set the infusion device and its regulation. Write on the IV label the date and time of insertion. After that, position your client in a comfortable position. Then, instruct to them to limit their movement to avoid injury and pain. Then, instruct your client not to remove the needle without the doctor's order. After we've done the procedure, dispose all the used needles into the sharp container. Then, remove gloves and dispose all the materials we've used in this procedure. After that, wash your hands and document all the necessary data for client care plan. Then, don't forget to check the client and IV site every hour.